What if the real danger isn't what you can see, but what's growing silently inside you? Prostate cancer is one of the most common yet most overlooked threats to men's health. According to the American Cancer Society, more than 288,000 men in the United States will be diagnosed with prostate cancer this year alone. That's 1 in every 8 men facing a diagnosis in their lifetime. Even more alarming, over 34,000 men will lose their lives to it, often because it wasn't caught early enough. But here's the hidden truth: prostate cancer rarely shouts. It whispers, through vague fatigue, subtle discomfort, or minor changes we tend to ignore. Many men don't even realize something's wrong until the disease has already spread. And yet, early detection can make prostate cancer over 99% treatable when caught before it moves beyond the gland. This video will reveal the earliest warning signs, the real causes behind this disease, and the evidence-based steps you can take to protect yourself, starting today. Because when it comes to prostate cancer, what you don't know can hurt you, but what you learn right now could save your life. Let's get started. 1. Erectile dysfunction. Struggling to maintain an erection, even when you're otherwise feeling healthy, might be more than just a momentary issue. Erectile dysfunction, or ED, is the inability to get or keep an erection firm enough for satisfying sexual activity. While it's often linked to stress, heart disease, or aging, it can also be an early warning sign of something deeper, like prostate cancer. When ED shows up without any obvious physical or emotional cause, it deserves closer attention. In some cases, a growing prostate tumor can interfere with the surrounding nerves and blood vessels essential for healthy sexual function. But here's something many men don't realize: even when prostate cancer itself isn't directly causing the problem, the treatments often can. Procedures such as prostate surgery, radiation therapy, and hormone suppression are known to affect the nerves and vascular structures involved in erections. In fact, according to a study published in European Urology, over 60% of men treated for prostate cancer report some degree of erectile dysfunction following treatment, whether temporary or long-term. So if ED appears suddenly and doesn't respond to usual remedies, don't brush it off as just another sign of aging. It might be your body's first signal that something far more serious is developing. Getting checked early not only protects your sexual health, it could also save your life. 2. Pain and discomfort in the pelvic area, lower back, or upper thighs. When most people think of prostate cancer, they imagine urinary or reproductive symptoms. But what if the first sign shows up in your legs? One of the lesser-known and more alarming symptoms of advanced prostate cancer is a sudden feeling of weakness, numbness, or tingling in the legs or feet. This strange and often unexpected issue can occur when the cancer spreads beyond the prostate and reaches the spine. There, it can compress the spinal cord or surrounding nerves, disrupting the communication between your brain and lower body. As a result, you might begin to stumble more often, lose your balance, or struggle to walk with the same control you once had. In more advanced cases, the effects can be devastating. Prolonged nerve compression may lead to paralysis, and even loss of control over bladder or bowel function. A 2019 study published in Nature Reviews Urology highlights that spinal cord compression occurs in approximately 5 to 10% of men with metastatic prostate cancer, often presenting as neurological deficits in the legs. So if your legs feel weak, tingly, or numb, and there's no clear injury or explanation, don't ignore it. It could be your nervous system sounding the alarm on something much deeper. Getting prompt medical attention could prevent lasting damage and uncover a serious diagnosis before it's too late. 3. Blood and semen. Discovering blood in your semen is more than just a startling moment. It can trigger deep concern, confusion, and fear. Known medically as hematospermia, this condition often causes emotional distress, and understandably so. While it may look like a harmless discoloration, ranging from pink to reddish-brown, it can sometimes be your body's signal that something serious is happening beneath the surface. In men with prostate cancer, a growing tumor can disturb the intricate network of blood vessels and tissues within the prostate. This internal disruption may lead to small amounts of blood leaking into the ejaculate. It's a physical sign that, although rare, shouldn't be overlooked. In fact, a 2020 study published in the British Journal of Urology International found that persistent hematospermia, especially in men over 40, is significantly associated with underlying prostate or seminal vesicle pathology. It's also worth noting that hematospermia can occur as a side effect of treatments like radiation therapy or prostate surgery, making it important to evaluate the context. But regardless of whether it's new or post-treatment, if you see this symptom happening more than once, it's time to speak with a healthcare professional. A proper evaluation can help rule out more serious causes, and give you peace of mind or early intervention when it matters most. 4. Fatigue. Do you feel completely drained, even after a full night's sleep or a quiet day with little activity? If you're experiencing a kind of exhaustion that lingers no matter how much you rest, it could be more than just getting older. It might be an early warning sign of prostate cancer. Unlike typical tiredness, cancer-related fatigue doesn't ease up with downtime. It's a deep, persistent weariness that can creep in gradually or strike without warning. Many men describe it as a heaviness they can't shake, mentally, physically, and emotionally. This type of fatigue is different because it's driven by your body's battle with cancer itself. The immune system ramps up inflammation to fight the disease. The growing tumor drains energy. And in some cases, the treatments designed to destroy the cancer, like hormone therapy, radiation, or chemotherapy, can make the fatigue even worse. According to the National Cancer Institute, up to 80% of men undergoing treatment for prostate cancer report moderate to severe fatigue, often lasting weeks or months. So if your body is constantly telling you it's worn out, and there's no clear reason why, listen. It may not be about what you're doing. It may be about what's happening inside. 5. Pain in the bones. Persistent pain in your bones, especially when there's no fall, injury, or strain to explain it, should never be ignored. While it might be easy to chalk it up to aging or arthritis, deep, unrelenting bone pain can sometimes reveal something far more serious: the spread of prostate cancer. As the disease advances, it frequently metastasizes to the bones, particularly targeting the spine, hips, and ribs. The discomfort can vary from a constant dull ache to sharp, stabbing pain that interferes with your movement and quality of life. What sets this type of pain apart is that it doesn't go away with rest or routine painkillers. It lingers, and in many cases, worsens over time. Scientific studies back this up. Research published in the Annals of Oncology shows that bone is the most common site of distant metastasis in men with prostate cancer, affecting nearly 90% of patients with advanced disease. This isn't just ordinary soreness, it's the body's urgent signal that cancer may have moved beyond its original location. So if you're feeling unexplained, lingering pain deep in your bones, don't dismiss it. It could be more than discomfort. It could be the clearest clue yet that something serious is happening beneath the surface. Early attention could be life-saving. 6. Unexplained weight loss. Losing weight without even trying might sound like a blessing at first, but when it happens for no clear reason, it could actually be a silent signal from your body that something serious is happening. One of the most overlooked warning signs of prostate cancer is unexplained weight loss, especially when it appears without changes to your diet or exercise habits. It's easy to blame it on stress, aging, or simply a faster metabolism. But when cancer begins to advance, especially beyond the prostate, it can hijack your body's metabolism entirely. The disease causes your body to burn through energy and muscle tissue at an accelerated rate, leading to noticeable weight loss that has no obvious cause. In fact, a clinical study from the Lancet Oncology found that cancer-related weight loss, also known as cachexia, is present in up to 60% of men with advanced prostate cancer. And the more the cancer spreads, the more it drains the body's energy reserves, even when you're eating normally. So if the numbers on the scale keep going down and you haven't made any lifestyle changes, don't ignore it. Weight loss might not just be a physical change, it could be your body's early cry for help. Recognizing this symptom early can mean faster diagnosis, better treatment options, and a greater chance of survival. 7. Frequent urination, especially at night. Are you waking up more than once each night just to use the bathroom and finding yourself drained the next day? If this has become a regular pattern, you're not alone, and you're not imagining things. This condition is known as nocturia, and while it's true that bathroom visits tend to increase with age, a sudden or worsening shift could point to something more serious, such as prostate cancer. When the prostate enlarges, as it often does in cases of cancer, it begins to press against both the bladder and urethra. This added pressure makes the bladder feel fuller, faster, even when it isn't. The result? An urgent and frequent need to urinate, especially during the night. A study published in the Journal of the American Medical Association found that men with prostate abnormalities are nearly twice as likely to experience disruptive nocturia compared to those with healthy prostate function. What makes this more concerning is the toll it takes over time. Interrupted sleep doesn't just lead to grogginess, it builds into long-term fatigue, lowered immunity, and reduced quality of life. If you're waking up 2 or more times a night and struggling to stay rested during the day, it's time to pay attention. Don't assume it's just age. It could be your body's earliest alarm that something more serious is developing. 8. A noticeable burning while urinating or during ejaculation. If you've ever felt a burning sensation while urinating or during ejaculation, you know just how unsettling and painful it can be. This kind of discomfort, ranging from a faint sting to intense, sharp pain, might not just be a passing irritation. It can be a sign that something deeper is happening inside your body. One possible explanation is that a cancerous tumor within the prostate is pressing against the urethra or inflaming surrounding tissues, triggering that burning feeling. Interestingly, inflammation of the prostate, also known as prostatitis, is often behind such symptoms. But so can prostate cancer, especially when the tumor begins to interfere with nearby structures. According to a review in the Journal of Urology, up to 19% of men with prostate cancer report irritative urinary symptoms, including burning during urination or ejaculation. While urinary tract infections and benign inflammation are common causes, the key point is this: persistent burning is never something to ignore. It may feel awkward or inconvenient to bring up with your doctor, but early detection is everything. If that burning sensation keeps returning or doesn't go away, don't wait for it to become unbearable. Let that pain be your signal, it's your body's way of urging you to act. 9. Inability to urinate while standing. Imagine heading to the bathroom as you've done countless times before, only this time, something feels off. You position yourself to urinate, but nothing happens. Or perhaps only a trickle comes, leaving you frustrated and confused. This unexpected inability to urinate while standing might seem like a minor inconvenience, but it could be an early indicator of something far more serious developing inside your body. Prostate cancer, when it begins to grow, often causes the prostate gland to enlarge in size. As this gland sits just below the bladder and wraps around the urethra, the narrow tube that carries urine out of your body, any expansion can press directly against that passageway. The result? A partial blockage that interferes with the natural flow of urine, particularly when the body is in an upright position. In fact, a clinical review published in BJU International highlights that lower urinary tract symptoms, including positional voiding changes like this one, are increasingly common in men with obstructive prostate conditions, especially among those over age 55. Faced with this pressure and reduced urine flow, some men instinctively shift to sitting in order to relieve themselves more easily, an adjustment that might seem trivial but speaks volumes about what's happening internally. While this symptom can also be linked to benign prostatic hyperplasia, BPH, it should never be dismissed outright. Any noticeable shift in how your body functions, especially something as fundamental as urination, deserves attention. It's your body's way of sending a signal. Listen to it. 10. Difficulty urinating. It often starts subtly, perhaps a longer wait before your urine begins to flow, or the strange sensation that you've just gone to the bathroom, yet your bladder still feels full. These small but persistent difficulties might not seem alarming at first, but they can be among the earliest signs that something isn't right with your prostate. Difficulty urinating doesn't present in just one way. For some men, it means struggling to initiate urination. For others, the stream becomes weak, stops and starts unexpectedly, or never feels complete. Medically, these issues are linked to changes in how the prostate interacts with the urethra. As the prostate enlarges, either due to cancer or benign conditions, it can begin to constrict the urethra, the narrow tube responsible for carrying urine out of the body. This narrowing causes resistance to flow and leads to the symptoms you may be noticing. According to a study published in European Urology, lower urinary tract symptoms, LUTs, such as poor stream, hesitancy, and incomplete voiding are significantly more common in men with underlying prostate abnormalities, including early-stage prostate cancer. While it's true that conditions like benign prostatic hyperplasia, BPH, are more frequent causes, any persistent urinary changes, especially in men over 50, warrant attention. The earlier these symptoms are investigated, the better the chances of identifying a problem while it's still manageable. Don't wait until the discomfort worsens. If something feels different, it's time to have a conversation with your doctor. 11. Blood in urine. Have you ever noticed a slight pink or reddish hue in your urine? While it might seem minor, this condition, medically known as hematuria, can be one of the first warning signs of something far more serious, including prostate cancer. The blood may range in color from light pink to dark brown, and in many cases, it's microscopic, meaning it can't be seen with the naked eye but is only detectable through laboratory testing. According to a study published in the New England Journal of Medicine, visible hematuria is present in up to 18% of men with prostate cancer, particularly in more advanced stages. That's why any trace of blood in your urine should never be ignored. While hematuria can also result from urinary tract infections, bladder stones, or kidney issues, its association with cancer, especially in men over 50, makes it a red flag. The American Urological Association, AUA, strongly recommends that anyone experiencing hematuria undergo a thorough urologic evaluation, including imaging and cystoscopy, to rule out underlying malignancies. Early evaluation is essential, because once prostate cancer progresses, treatment becomes more complex and outcomes less favorable. So if you ever spot blood in your urine, even once, Don't wait for it to happen again. Take it seriously, talk to your doctor, and request the proper tests. Your attention to this one detail could quite literally be the difference between catching cancer early or allowing it to grow undetected. Stay alert to changes in your urinary health, because sometimes, your body whispers before it screams. Understanding what triggers prostate cancer isn't just useful, it's potentially life-saving. While this disease is complex, scientists have pinpointed several key factors that influence your risk. At the heart of it, prostate cancer begins when the DNA inside normal prostate cells starts to change. Sometimes these changes are inherited, passed down through generations. In fact, inherited genetic mutations, such as those found in the BRCA1 and BRCA2 genes, which are also linked to breast and ovarian cancer, account for about 10% of all prostate cancer cases. But in most instances, the damage isn't inherited. It happens during a man's lifetime, as his cells divide and replicate. Over time, tiny errors in that process can stack up. And when those DNA instructions go haywire, cells can start multiplying uncontrollably, forming a tumor. Still, genes aren't the whole story. Lifestyle plays a powerful role. A high-fat diet, especially one packed with red meats and full-fat dairy, has been associated with a higher risk of prostate cancer. On the flip side, men who eat more fruits, vegetables, and fiber-rich foods may actually reduce their risk. Obesity is another big factor. Being overweight doesn't just strain your heart, it increases the chances of developing more aggressive forms of prostate cancer. And that's not all. Environmental exposures and lifestyle habits, like smoking and heavy alcohol use, also add to the risk. Then there's the issue of race and genetics. African American men face a significantly higher risk compared to men of other races. And if your father or brother has had prostate cancer, your chance is more than double. It's a disease where family history truly matters. Now, while there's no guaranteed way to prevent prostate cancer, you're not powerless. In fact, a few smart habits can significantly lower your risk and help protect your health long-term. Start with your diet. What you eat matters more than you think. Focus on nutrient-dense, plant-rich meals. Load up on colorful fruits and vegetables, whole grains, and lean proteins. Tomatoes are a great choice, they're high in lycopene, a powerful antioxidant. And don't forget omega-3s, found in fatty fish like salmon, which may offer added protection for your prostate. Next, maintain a healthy weight. Keeping your body mass index, BMI, within a healthy range can make a real difference. Dropping just a few extra pounds could reduce your cancer risk more than you realize. Movement is just as crucial. A sedentary lifestyle doesn't just affect your joints, it affects your longevity. Make physical activity a part of your daily routine. Try to get at least 150 minutes of moderate aerobic exercise each week. It doesn't have to be complicated, brisk walking, swimming, or cycling can all do the trick. And finally, stay on top of your checkups. Regular screenings can be your best defense, especially if you're over 50 or have a family history. A quick conversation with your doctor can help determine the right time to begin annual prostate exams. Early detection makes all the difference, not just for treatment, but for peace of mind. So don't ignore the signs. Stay informed, stay active, and most importantly, stay proactive. Prostate cancer may be common, but with the right knowledge and action, you can take control of your risk, starting today. Prostate cancer doesn't always arrive with flashing lights or loud alarms. Sometimes, it begins quietly, with a change in how you feel, how you sleep, or how your body works. And that's why staying informed isn't just helpful, it's essential. The more you understand the signs, the better equipped you are to catch it early, take action, and protect your future. So if any of the symptoms we discussed today feel familiar, or if you simply want to take better care of your health, don't wait. Talk to your doctor, ask questions, and be proactive. Your body is always speaking to you. The question is, are you listening? And if you found this video helpful, make sure to give it a thumbs up, share it with someone who needs to hear it, and subscribe to our channel for more life-saving health insights every single week. Because your health matters, and we're here to help you protect it.